everyone. Today my patient is Miss Mary Jenkins. I'll be sharing more about Miss Jenkins' history, my teaching strategies for her, and lastly, the presentation I presented to her. Miss Jenkins is a 55-year-old woman and has a few struggles of her own. She suffers from diabetes and chronic back pain. To add to that stress, she works full-time as an administrative assistant and is now dealing with her newly incarcerated daughter. She has recently taken over care for her 8-month-old grandchild because of her daughter's circumstances. She is trying to make the best of the situation and look at this as a new opportunity for her grandson. It has been some time since Mary has cared for a young child, so she sought out help during her last diabetes checkup. She hopes to learn all she can about child disorders and the signs and symptoms to watch for as her grandchild grows. Before Ms. Jenkins' appointment, I wanted to make sure my teaching strategies I presented were pieced together in a way best suited for her and her needs. When teaching someone her age, it is important not to assume, but to be aware of these types of factors. First, the obvious being stress, which can be brought on from work and lifestyle issues, or midlife consciousness as they call it. Second is physical changes like menopause, or in her case, more chronic diseases like back pain and diabetes. Third, her new responsibility of caring for a child again and potentially having to care for her parents. And finally, she might have self-doubt, which is important to recognize as soon as you can, because this can affect her self-esteem and openness to learning. We want to be sure to encourage Ms. Jenkins as often as we can by letting her know that she can do this. To tackle these factors, I've set out strategies for myself to compliment, reinforce, and reward. I want to compliment her for reaching out and wanting to learn new information. I'm going to reinforce how this will benefit her and her grandchild's life. And the reward will come with her newfound knowledge that will give her more confidence in her new situation. Here is the presentation I presented to Ms. Jenkins. Hello, Ms. Jenkins. I am so thrilled you have taken the time to learn something new today. I know you're going through a tough time and it can't be easy, but this is a great first step to benefit you and your grandchild's life. There are a number of topics we will be going over today, so I'll try my best to discuss those that will affect you and your grandchild. Things like anemia, asthma, taking a temperature, the stomach flu, ear and sinus infections, and croup are things that you should focus more on. But we'll briefly go over things like cardiovascular risks, seizure disorders, tonsillitis, and virus control. Let's jump right in. I know you have a busy schedule. First, we'll talk about anemia. A child may become anemic because of a low production of red blood cells, but most commonly because of a low iron intake. Signs and symptoms are pale skin, fatigue, and slow growth and development. The treatment for anemia depends on the cause. If it's just dietary, then foods rich in iron, including red meats, pinto beans, and dried fruits, will help. If it's something more serious like sickle cell, children with sickle cell disease need to receive regular health care with a special emphasis on eating and drinking well. Watch for fever and be sure to vaccinate against infections when possible. Next, there is asthma. Asthma is a chronic inflammatory disorder of the lungs and is the most common cause of chronic illness and hospitalization in children. Signs and symptoms are the increase of mucus production, inflammation of the airways. You might hear coughing, wheezing, and increase of difficulty of breathing. To manage this, it's important to have an early diagnosis and have patient and family education. To treat asthma, there's a combination of therapies. Therapies including steroids, medicines that open up the airways quickly, and medications that help maintain the disease. Next, we have taking temperature. Parents need to understand how to take a child's temperature. There are several different ways to take a child's temperature. First, by mouth, underneath the arm, by the rectum, or the ear. Here are the normals. If the temperature reaches 103, it is important to schedule an appointment with your physician or take them in to a quick care facility for treatment. Next, we have the stomach flu. This is a very common pediatric illness. Signs and symptoms are diarrhea, vomiting, stomach pain, and sometimes fever. Management is important in infants and young children because the loss of water can cause dehydration and an electrolyte imbalance. It's important to rehydrate and reintroduce foods like bananas, rice, carrots, and toast. If the baby is breastfeeding, reintroduce breastfeeding. Next, there is ear and sinus infections. Signs and symptoms are a sore throat, fever, or an earache. These are usually caused by a viral infection, so management should be penicillin, but only after having a positive result of a virus. Children will be contagious up to 2 days following. Next, there is croup, which can be diagnosed with the signs and symptoms of a bark-like cough or difficulty breathing. The majority of childhood croup is mild and can be managed at home. However, if it becomes serious, hospitalization is needed. Racemic epinephrine will be used to open up the airways. Warm and cold mist is also helpful. Some of the other disorders that you can be on the lookout for are listed below. Cardiovascular risks are very important, and it is important to have a healthy lifestyle. Things like smoking and a high sugar and fat content diet are risks. Next, there are seizure disorders. This is a chronic neurological condition. Epilepsy being one of the most common seizure disorders in kids, drugs can help, and this should be monitored. Tonsillitis is a viral infection, and it needs to be evaluated by a doctor. Things like fever and rash will appear to give signs of tonsillitis. One of the most common causes of illness in children is a virus. It's connected to things like ear infections, tonsillitis. You'll find fever, diarrhea, and vomiting. This needs to be monitored, but it's important to let the body try to fight off this infection to build antibodies against the infection before treating with medication. Ms. Jenkins, this concludes our presentation for the day. Thank you so much for taking the time out of your busy life to come and learn something new today. We can go over whatever topics you have more questions about. I want you to feel confident that you're doing what is best for your grandchild, so I'm going to send home some reading material with you. What you're doing here is admirable. Have a wonderful day.